Buenos días, buenas tardes o buenas noches para ustedes. Mi nombre es Natalie Hoyos y soy una psicóloga colombiana. I'm part of this group of people who aims to bring the first perinatal and pediatric hospice to Colombia. We live in a country where even the palliative care meaning is not well understood. Most of the people thinks that talking about palliative care is talking about a death sentence. And when we talk about perinatal or pediatric population, it's even harder to get to the people. Sometimes these children are in really poor neighborhoods or on the countryside, so the conditions to have the treatment or to access the treatment are really hard. They have to travel for long distances, and when they are in the countryside, they don't even have where to stay here in the city to access to the treatment. So sometimes they have to try to access to these free shelters in the city to be able to have like the active treatment. Also, we are talking about palliative care, about hospice care, which means that we are talking about total pain. It's not just about physical, but we are talking about psychological, spiritual, social, everything that involves the family or even the brothers or sisters of these kids. And they don't have access to that. We live in a country where this is very limited. So sometimes they have access to the active treatment, but for example, they don't have access to counseling or to some support, some kind of support for the conditions that they have already in their situation. So we are hoping to be able to bring the first hospice to Colombia. It will be just the third one in Latin America. What we have now, it's a piece of land where we hope to build the hospice, and a Palatine's house where we expect to give like an outpatient service. And also to be able to give them free shelter for these people from the countryside. Most of these kids are really poor people who has to travel really long distances and sometimes don't have access to all the services that they may need to be able to talk about really palliative care. So we have cases where they don't have the access to just transportation from their houses to the hospital to receive treatment, or maybe they have like the active treatment but they don't have a psychological counseling, or they don't have a psychiatrist appointment, or even the hospital doesn't know the conditions of these people and if they have access to all the services that they need. Also, we know that these children are full of dreams, are full of life. They sometimes doesn't understand the meaning of having a terminal disease. And when we focus just in active treatment, we are just focusing in the disease. We are not focusing in the life of this child. And what I remember the most were the words of Father Peter Krakowiak, where he said that it's not just about having time to live, but bringing life to the time we have. So I really consider that hospice can be a part of life, and we can improve the quality of life of these children. So thank you so much for your attention, and I hope that you get in love with this project as much as we do. Thank you.